This is a film about selling pain.
Me duele. Me duele. Me duele. Me duele. Me duele.
It's about big drug companies and the sophisticated marketing playbook that fueled an opioid epidemic.
An opioid epidemic has reached Australia.
An opioid crisis.
Codeine and tramadol.
Non-medical use of prescription drug has reached epidemic proportions.
So something has to be done.
This story only starts in the United States.
We are facing the deadliest drug crisis in American history,
and unfortunately shows no signs of ending.
Where one pharmaceutical company has gotten a lot of the blame. The makers of OxyContin, Purdue Pharma.
1, 2, 3.
Purdue Pharma!
Purdue Pharma! Here are the men. That's white coat man with skills to take. White coat man with skills to take.
Every single one of us was lied to about OxyContin!
They even admitted it. Sort of.
The maker of a hugely popular painkiller has some pain of its own tonight.
Back in 2007, as part of a huge settlement, Purdue pleaded guilty to misleading doctors and patients. And that was just the beginning.
More than 1,600 lawsuits.
We, the state of Oklahoma.
State of Wisconsin has filed suit
against Purdue Pharma.
Drug manufacturer Purdue Pharma.
Misrepresentation.
The lies.
Knowing how addictive it was.
Companies gave doctors fraudulent marketing so they could profit from pain.
For Purdue, it was all about the money.
Now, one of the largest suppliers of the addictive painkiller OxyContin says it will no longer promote the drug to doctors.
Purdue even laid off their sales staff. End of story, right? But here's the thing. They're still doing tons of business, and not just in America. Purdue is the U.S. part of a huge network of pharmaceutical companies. Here's how one company in the network explained it.
The Mundipharma group is known as Purdue Pharma in the USA, NAP in the UK, and Mundipharma in the rest of the world.
Members of the Sackler family own Purdue and Mundipharma through trusts, and a lot of their billion-dollar profits are now coming from overseas. So after all these lawsuits in America, somehow Mundipharma and many other companies are finding ways to keep making lots of money off opioids. What are they doing overseas that's so different from the stuff that got Purdue in trouble here?
Me, I'm Mundipharma, and we're just getting started.
Mundipharma, we bring more to life.
First, you've got to understand this whole marketing playbook that Purdue used in the United States. This advertisement lays it out, and it starts with a simple idea. The world is suffering from an epidemic of chronic pain, like this guy is suffering. These pins are his pain. And he doesn't need to be suffering because there's a safe, effective treatment: opioids. The message is pretty clear. The company spread these messages in ways that are a lot more subtle than a single advertisement. We've pieced together Big Pharma's opioid marketing practices, what we're calling their marketing playbook, and it's got tons of parts, involving money and medical journals and conferences and doctors and advertising and patients. But it's all part of a coherent strategy. It can be a little hard to see it that way, so we hired Charles. He's a voiceover artist who does a lot of ads.
Fa-fa-fe-fa-foo-fa-fe-fa-fa-fa.
Hi, Charles.
Here's how to sell drugs. Here's how to sell drugs.
But we'll come back to him. Because we also need to explain what we actually know about prescription opioids.
Opioids are fantastic medications that are essential for healthcare.
Meet Keith Humphreys. He was a senior advisor at the White House Office of National Drug Control Policy.
And it might even be more important from the opioid epidemic, which after all was started not by criminal gangs, it was started in the healthcare system.
Now he's a professor at Stanford who studies how to treat addiction.
Opioids are extremely good dealing with injury and other sort of acute harms. They're essential for surgery. They're also essential for palliative care, for example, when people are dying of cancer.
This is worth emphasizing. Opioids aren't bad in and of themselves. They're essential for short-term use, like after surgeries or for treating the pain associated with cancer or a terminal illness.
Chronic use of opioids, which is longer than 3 months, increases the risk of addiction and also tolerance, meaning that the body builds up more and more resistance to the medication. You have to take more and more of it to get the same effect.
If you take opioids long-term, they become less effective, and you're more likely to become addicted. These estimates suggest about a quarter of patients who are prescribed opioids for chronic pain misuse them, and around 10% end up addicted. But drugs people take long-term, that's where the money is. A patient who needs a drug for a couple weeks isn't as profitable as a patient who needs that drug every week. So in the 90s, Purdue began to aggressively market opioids for chronic pain in the US.
There's no question that our best, strongest pain medicines are the opioids.
Once you've found the right doctor, don't be afraid to take what they give you.
And it was really successful. Between 1999 and 2002, Purdue more than doubled their sales. The number of prescriptions for OxyContin also doubled. And the rate for drug overdose deaths involving prescription opioids almost doubled too. Purdue's marketing is just one part of a complex pharma machine that led to the crisis. There's also loosening regulations, incentives from insurance companies, lots of other opioid manufacturers and distributors, and a burgeoning black and gray market. So let's go back to Charles.
Addiction is concerning, so ease the prescribers' minds.
So the cure for pseudo-addiction, you were trained, is more opioids.
A higher dose, yes.
Carol Panaro was a sales rep for Purdue Pharma for 5 years, when OxyContin was their blockbuster drug.
The concern about addiction would come up with the doctors, and they might say to you as a representative, well, isn't OxyContin addicting? As a salesperson in general, you understand that an objection is a buying signal. That means they're interested. So again, the objection might be, well, everybody that takes that is an addict. Okay, so how do you handle that objection?
Here's how to handle any objections prescribers may have. Present facts like this one. The risk of addiction is less than 1%.
The rate of addiction amongst pain patients who are treated by doctors is much less than 1%.
Less than 1% of patients taking opioids actually become addicted.
Less than 1% sounds very safe. People take 1% risks every day. It's a great selling point. It's not science, but it serves a corporate agenda.
Chris Johnson is a doctor who started noticing more and more opioid overdoses from chronic pain patients in his emergency room.
I'm going to talk to you today about the opioid epidemic, and we're going to begin with an apology. On the behalf of the medical industry, we failed you.
Now, Johnson is also on the board of an organization called Physicians for Responsible Opioid Prescribing.
When I started doing research into the literature supporting increased use of opioids for chronic non-cancer pain, I realized, oh my goodness, what have we done? When the study that this doctor sent me was a 5-sentence letter to the editor.
Doctors and medical journals were stating that the risk of addiction was less than 1%, but that statistic came from a letter. 5 sentences written to the New England Journal of Medicine in 1980 on rates of addiction for patients who took at least one opioid while at the hospital.
But it said nothing about putting patients on these medicines in pill form indefinitely. Nothing about that at all.
Here's one of the letter's authors, Herschel Jick, on that 1% number.
That was used by drug companies who created these new opioids and concluded that they were not addictive. But that's not in any shape or form what we suggested in our letter.
And how do you feel about that?
Well, to be honest, I'm mortified.
In the 90s, after Purdue started marketing opioids for chronic pain, that letter was referenced a lot in medical literature. It was cited more than 600 times. Now, that statistic rarely appears in America. But something weird happens when you look outside the US.
I think it's about 1% of people who are on opioid pain relievers who are dependent on the medication.
Big Pharma's opioid marketing playbook, it's gone global.
And this brings us to the next rule of opioid marketing. Find some experts. Hire medical leaders to educate doctors about the value of opioids, like Willem Scholten.
People often think that if you use opioid analgesics for pain, that you have a very high risk that you will become dependent. But the risk is very low. What I'm trying to say all the time is that pain medication does not lead to dependence.
Willem Scholten used to work for the World Health Organization. He was team leader for access to controlled medicines. Now, he consults for pharmaceutical companies as well as NGOs.
Good. There's a lot of fear for opioids in the world, and most of the time that's not justified.
Scholten cites 2 reviews as evidence.
According to the Noble study, the risk of becoming dependent is 0.05%.
This Noble review was published in 2008. It reviewed earlier studies on long-term opioid use for chronic pain.
This study is a meta-analysis, which means it combines many studies that have been done over time. So it's not a subjective truth.
The decade-old review did find low rates of addiction in the studies it included. But it also said the evidence was low quality, making any conclusions unreliable. And the authors noted that most studies had screened out patients at higher risk of addiction.
You can find case studies to prove witchcraft work. Case studies aren't helpful because you get pick and choose who you want to select in your criteria.
There's another study which is highly authoritative by Minozzi. Their final conclusion was that opioids cannot be withheld to pain patients because of the risk of becoming dependent.
The Minozzi review is from 2012. And the study's authors also concluded that the quality of evidence was very low and could not be considered conclusive. We showed the study to Johnson.
Nonsense, a review article comparing multiple different types of studies. This is what you do when you don't have good data.
Long-term studies on the risk of addiction are expensive and difficult to do. So good data is hard to find, but no independent experts we spoke to said the risk was less than 1% or pointed us to these reviews. Most gave a range. The U.S. National Institute on Drug Abuse looks to a newer review, the one that estimated that about 10% of patients taking opioids for chronic pain end up with opioid use disorder, what's commonly called addiction, and about a quarter misuse their medication.
I often talked with doctors. When I asked them how many of your pain patients have become dependent, they often couldn't remind not any patient that's supportive yet in the for the conclusion.
That's the best they got? Yeah, that's poor. They should know better. They do know better.
What would you say to people who say there is a financial gain in downplaying the addictiveness of opioids?
I think when you look in literature, there is no financial incentive.
Addiction, when treating pain, is distinctly uncommon.
Russell Portnoy was a key opinion leader who used to cite the less than 1% statistic when talking about the risk of addiction. He was named in several lawsuits filed against Purdue Pharma. He testified against the industry in return for being dropped from the suits.
I gave so many lectures to primary care audiences in which the Porter and Chick article was just one piece of data that I would then cite, none of which represented real evidence. And yet what I was trying to do was to create a narrative so that the primary care audience would look at this information in toto and feel more comfortable about opioids. And because the primary goal was to destigmatize, we often left evidence behind.
That's not the only part of the American opioid marketing playbook that started to travel worldwide.
Which brings us to the next rule. Give your experts a platform. Pay for medical journals, studies, and conferences to educate doctors on the most important information.
Consultants and key opinion leaders get paid to speak at industry-funded conferences.
This is my declaration of interest as a consultant. I have many customers, so I also work for many companies.
The reason you use a key opinion leader, the reason you set up these speaker programs, is so that the attendees, the other doctors that go, hopefully, they're going to feel more comfortable prescribing your product, and when they go back to their practice, they're going to prescribe it more.
The prominence of the key opinion leader or thought leader is such that, well, this person is the head of a major pain center in New York or Boston. Who am I to question them?
And yep, this is still happening around the world.
The role of the key opinion leader was to convince the regular doctors like me that my reluctance and concerns for patient safety were unfounded. Opioids were much safer than traditionally known and could be used for much broader reasons.
This is Tony O'Brien. In 2017, he received honoraria for lectures and support for travel from Mundipharma. And this is O'Brien at a conference that same year talking about opioid use for chronic pain.
In the general press, it's all about the opioid epidemic, and nobody's talking about pain. We have lots of misconceptions that they're inherently dangerous, that they shorten life, that we're going to see addiction as being a problem, an exaggerated fear. The number of people in pain who are treated with an opioid and who become addicted, that's a very, very tiny percentage. Opioids are an essential tool.
O'Brien's main reference for his presentation was a position paper he was lead author on. That paper was paid for by an organization part funded by 3 opioid manufacturers. It was published in a journal owned by that industry-funded organization. And it was presented via a platform also funded by an opioid manufacturer.
So that's my disclosure.
We reached out to Tony O'Brien, who said the paper, quote, best represents my views on the appropriate use of opioids in chronic pain management, but otherwise declined to comment on his relationship to the industry. When we reached out to Mundipharma for this story, the company said O'Brien's paper was the best source on using opioids to treat chronic pain, saying it reflected the conclusions of independent experts. And yet, this is the conflicts of interest disclosure for O'Brien and his co-authors. They receive fees and grant support, speakers' fees, honoraria, and consultancy fees from all these companies. Archimedes, AstraZeneca, Cephalon, Grunenthal, Roche, Janssen Civa, GW Pharmaceutical, Pfizer, Abbott, Mundipharma.
Tous les congrès internationaux ont besoin d'être financés, sinon ils coûteraient trop cher en inscription, donc sont financés par des laboratoires pharmaceutiques qui sont présents. La médecine, comme vous le savez, sa première mission, c'est de traiter la souffrance humaine, la souffrance, qu'elle soit physique ou psychique.
Nicolas Autier leads an observatory tasked with watching for signs of the opioid crisis spreading to France.
You're welcome. Et bien entendu, les laboratoires ont un intérêt direct à être présents pour faire la promotion de leurs médicaments.
We went undercover to a pain conference in France, sponsored in part by Mundipharma. We filmed with secret cameras.
Ça va? D'accord.
Tony O'Brien spoke at a Mundipharma-hosted lunch there.
Thank you for your attendance. It's a great pleasure to be here, and my thanks to Mundipharma for convening this important symposium.
And we asked a speaker at the conference how she felt about the pharmaceutical company's involvement.
Moi, je trouve qu'ils sont très impliqués, trop impliqués. Trop impliqués un peu? Ouais. Moi qui parle, je ne suis pas payée par le congrès parce qu'ils n'ont pas de sous, c'est le laboratoire qui me paye mes nuits. Ah, oui. Cette position n'est pas normale. Pas normale. Alors après, ça manque de sous et il faut fonctionner les choses, mais c'est une réalité quand même.
Mais on peut retrouver en France, sur un site internet, la totalité de ces liens d'intérêt ou de ces avantages qui existent et qui sont donnés par les laboratoires.
The French Ministry of Health has a database where I can look up any medical professional or medical organization and see if they have any connection to any of these labs, including Mundipharma.
Receiving financial support from the industry is not an automatic indication of wrongdoing, but it's happening a lot. In the past 5 years in France alone, we found 51,149 payments to health professionals from Mundipharma, in exchange for attending medical conferences, writing medical studies, giving scientific presentations, and more. Mundipharma told us it no longer directly promotes opioids to healthcare professionals in Europe. Its companies do compensate some medical experts, but only within industry guidelines, and do not write presentations for them. In Italy, the relationship between doctors and pharma execs is under criminal investigation. Mundipharma Italy was accused of illegally paying a well-known pain doctor for promoting opioids.
Vogliamo portare il messaggio che il dolore è fuorilegge, che il dolore si può combattere e vincere.
Che cosa facevano in pratica? Ingerenze per i convegni ECM, i convegni di educazione continua in medicina, presso i quali si consentiva alle aziende farmaceutiche di individuare gli argomenti da trattare, i relatori e anche le scelte.
2 executives accepted plea bargains and lost their jobs. Mundipharma Italy was fined along with another opioid company, though all said they admitted no guilt. The doctor's case is still ongoing.
E questo per una molteplicità dei casi che ci ha fatto parlare di corruzione nella forma più grave.
C'est un rôle de toute entreprise privée de favoriser la vente de leurs produits. C'est une action qui paraît tout à fait légitime. Mais il ne faut pas être naïf, il faut le regarder en tant que tel, et ça n'empêche pas de garder son indépendance et son esprit critique vis-à-vis de ses produits.
Next, inform the patients. There is an epidemic of pain around the world. Patients don't need to suffer. We're here to help.
If you have a lot of pain, you're probably going to ask Google what to do about it. So we did that. We found patient support groups and charitable organizations with advice on how to treat pain. The thing is, every one of the links we're showing you either is or gets money from an opioid manufacturer. We did this in different languages. Every one of these gets money from an opioid manufacturer.
Más de 7 millones de españoles sufren dolor crónico.
Weltweit sind chronische Schmerzen ein großes Problem.
But 100 million people in Europe who suffer from it shouldn't be.
It's hard to find a chronic pain group that isn't financially connected to opioid manufacturers. Remember this ad?
El dolor crónico se puede tratar. Vive.
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 Supported by Mundipharma. These industry-funded groups published materials with key talking points that sales reps like Panara would hand out to prescribers.
These publications would have articles addressing maybe, like concerns that doctors might have about opioids. So are your patients, are they experiencing a good quality of life? If not, why not? As a representative, you want to work that in the conversation with the doctor. You want the doctor to have that conversation with the patient. And the end result is hopefully that leads to more prescriptions to address it.
That phrase, quality of life, appears a lot in promotional material on chronic pain around the world.
When it's your pain and your quality of life.
Your quality of life.
Tu calidad de vida.
Livskvalitet.
Treatments for chronic pain patients is important to improve quality of life.
To improve the quality of life.
Improve the quality of life.
Quality of life.
Quality of life. Thank you for giving me the opportunity to say something about chronic pain from the patient's perspective.
So we met with the head of one of these patient groups. Meet Joep van Greensven, the president of Pain Alliance Europe.
That crisis which you're talking about is mainly a crisis for the patients who need the opioids to get a better quality of life. If you deny them the opioids, they are living in unbearable pain every day.
Pain Alliance Europe describes itself as a patient-led organization advocating for quality of life for people with chronic pain.
Opioids are just a very good medication for people with chronic pain. And if it's done on a proper way, then there's no problem with opioids.
Pain Alliance Europe includes 43 organizations in 19 countries. And Van Greensven says his organization has received funding from multiple opioid manufacturers, including Mundipharma.
The primary reasons for pharmaceutical companies to provide money to patient organizations, they want to do something on the quality of life of the patients. And it most certainly is not for selling products.
Unfortunately, it's very hard to find other funding. And governments don't give huge subsidies to patient organizations.
Right, so it's an inevitability almost.
Yeah, or you are invisible and you don't do anything, or you accept that you are working with commercial funding.
There's an intentional blurring of the lines by companies who want to sell product to say we care about pain, and of course we all care about pain, and then they say, and the only way to solve that is to buy a lot of this stuff we make. And that is just not true.
I never see any advertising for any products at all.
Because some people would say, well, there's a huge market for chronic pain, and people are going to listen to a patient organisation more than a company. So this is a very handy form of indirect advertising. Do you see any of that in your work?
In our organizations, and I only can speak for my organization, because we don't advertise for any kind of therapy.
In the mid-1990s, an industry-funded patient advocacy group called the American Pain Society recommended pain as the fifth vital sign. It made pain assessment as important a measure of well-being as heart rate and breathing.
Vital signs include temperature, pulse, respiration, blood pressure, and pain, and are performed routinely in every healthcare setting.
It has since been cited as one of the drivers that pushed doctors to prescribe more opioids.
There was a notion that pain was the fifth vital sign, that you wanted to relieve pain, that was essential. You dosed until the pain was alleviated.
That, says Kessler, was a costly mistake.
In 2016, the American Medical Association recommended pain be eliminated from professional medical standards, and the American Pain Society filed for bankruptcy over lawsuits accusing them of acting as a front group for opioid manufacturers. Now in the EU, the opioid manufacturer Grünenthal is funding a Pain Alliance Europe-supported platform, lobbying for pain as a key indicator as well as chronic pain as a disease in its own right.
ICD-11 is so important for the quality of life of chronic pain patients across Europe.
If you have chronic pain identified as a disease in its own right, it will be more clear for politicians and policymakers what the costs are for people which have chronic pain. Lobbying itself there's nothing wrong with it, because lobbying is trying to get things changed in a way which gets improvement of what you want.
You are an industry spokesperson. If you are taking their money and that is supplying the funds for your organization, you represent that industry then.
Opioid manufacturers fund chronic pain organizations across Europe.
Unfortunately, the answer to suffering hasn't been opioids. I don't want people with chronic pain to suffer. I'm simply telling them the data is clear. These are not the answer.
And one of the most important rules, keep your reputation clean. And remember, it's medicine, not drugs.
What's going on? I got 2 overdoses and 2 babies in the house.
Purdue wanted to distance themselves from what was going on as far as abuse.
She is? Yeah. Can you hear me? Sir. Wake up on me. Don't fall asleep.
We were told if you're going to refer to OxyContin, refer to it as OxyContin, never refer to it as Oxy, because that's what it's called on the street. So even in your call notes, if you're trying to type fast and you're trying to abbreviate, if you say Oxy, they're going to flag it and you're going to get a phone call.
Abusers aren't victims, they're the victimizers. By the way, that's a quote from our very own Richard Sackler.
If there is an increase of overdose deaths because of opiates, it's about the abuse and the misuse of opiates. It has nothing to do with opiates being available for people with chronic pain.
Multiple overdose deaths. There are allegations of irresponsible prescribing practices.
The same risk you have to get addicted to opioids is the risk you have in society to get addicted to any drug.
The sales went up, the treatment admissions went up, and the deaths went up. The slope of the curve was slightly different because not everyone who takes opioids becomes dependent and then another percentage becomes addicted, so the slope of the curve is different, but it went up proportionally and exactly at the same time.
They're totally different populations. People who are dependent are, for the very large part, people who are using illicit substances from the black market.
And remember, drugs are bad, medicine heals.
Drugs are bad,
Medicine heals. Medicine.
bad.
सबसे ज़्यादा डिमांड जो है वो फार्मेसियों पे हमें तो सबसे ज़्यादा फ़ायदा जो है वो ये दर्द की दवाई बनाने में ही है.
This is an opioid drug factory in Pakistan.
आप देख सकते हो कि यहाँ पे भी ये दर्द की दवाई बन रही है. यहाँ से इसको पीस के फिर ये यहाँ पे और इसको जो दवा जिस रंग की होती है उसके हिसाब से इसका हम रंग करके अभी दर्द की दवा अभी हम बना रहे हैं वो एक तो ये भी दर्द की दवा है.
They copy popular drugs in the legal pharmaceutical world and produce cheaper alternatives.
वो हमारा खरीदार है, जाहिर है वो तो हमें जब ऑर्डर दे रहा है तो उसको तो पता है वो किस किस्म की दवा बनवा रहा है. इस पे जो सबसे बड़ा इल्ज़ाम है वो बिल्कुल अद्वियात बनाने वाली कंपनियों के ऊपर ही जाता है. वो किस तरह वो इस तरह के वो इन अद्वियात को बनाते हैं, वो जितनी ज़्यादा इसको बेचेंगे उतना ज़्यादा उनका वो पैसा कमाएगा.
And then there's the gray market, the intersection of the legal market and the black market.
We are basically selling every popular medicine which is available in the local pharmacies and more.
Online markets like this company resell legitimate prescription opioids around the world.
My job in this company is basically to see which medicine is selling the most and to make sure that we have the availability. And if there's any new trend, we try our best to cater to our customers' needs. And the demand for opioid-based medicine is going up drastically.
The legal opioid market and the illegal market are a lot more closely connected than people realize. And when the legal market explodes, it shows up in the illegal market. And a lot of those legal products end up in the black market, sold by people who got them legitimately.
I would strongly encourage anyone viewing this problem as just like, oh, it's just the illicit stuff, it's not. No, you view them as the same, okay? And that's because your brain views them as the same. They are intimately related.
In the US, opioid prescriptions rose first, followed by a rise in prescription opioid overdoses, an early sign of the crisis. Then we saw an increase in overdoses from black market drugs, first heroin, then fentanyl.
Le potentiel addictif des molécules opioïdes existe, que ce soit une drogue ou que ce soit un médicament.
Now the crisis is much bigger than Purdue, OxyContin, and the US. Mundipharma is just one of many large international opioid manufacturers. And now opioids, both legal and illegal, are seeding crises around the world.
Codeine is in large quantities. Tramadol, you can buy cartons of it. Where do they get it from?
Opioid-related deaths have doubled in the last decade.
While millions of tablets are flooding the market, the United Nations are now sounding the alarm.
The teen is one of the latest victims of BC's fentanyl crisis.
It doesn't have to be this way. More opioids don't automatically create a crisis. Take Germany, for example. They have one of the highest daily doses of opioids in the world, and yet the country's overdose rate is just a tiny fraction of that in the US. One factor may be the way they treat chronic pain, with a range of approaches, not just drugs. Germany also has strict anti-bribery laws, which limit the monetary value of gifts Big Pharma can give to health professionals each year. Regulations like that can be a key line of defense.
You need to keep clear blue water between corporate industries who make their living by selling opioids and the education of doctors and the conduct of the healthcare system.
But monitors and regulators are also vulnerable. In Italy, the doctor accused of taking kickbacks to promote opioids helped write one of the first laws in Europe about chronic pain management, making it easier for doctors to prescribe opioids. A 30% spike in some opioid prescriptions followed, and the Mundipharma executive accused of corruption pushed for more.
Il consumo degli opioidi in Italia è ancora molto basso. Secondo me potremmo dire, prima di tutto, alle autorità che incentivino la legge 38, perché molte delle cose scritte nella legge non sono ancora state attuate.
I have no problem at all with the pharmaceutical industry developing useful products. I'm glad they do. They save patients' lives. But that does not mean that I have to condone, as a public health professional or as a citizen, rampant pursuit of profit at the expense of public health.
Je ne suis pas contre les laboratoires, mais je pense que les médecins doivent garder leur autonomie, leur indépendance intellectuelle dans le choix de leurs prescriptions. Et je pense qu'un médecin bien formé a largement plus de capacité à faire ce choix de prescription que ne peut lui apporter un laboratoire.
Now that you're ready to go out and make some sales, Let's recap. Create the demand. Present the solution. Handle objections. Close the deal.
That's it.
A core part of the industry playbook is to cite a worldwide epidemic of untreated pain. And this part of the playbook is actually true. There are plenty of countries in the world where people in terrible pain need opioids. But the opioid the world needs more of is cheap, generic morphine. Few companies are interested in promoting it because that's not where the money is. The real money is in higher cost prescription medicine. So the pharmaceutical machine is far from broken. Purdue's total fines to date are just a small fraction of their global network's estimated annual revenue, and that network just keeps growing.
Mundipharma is actually now present globally. It's not only China, it's emerging markets.
Expanding into new geographies.
Access to people in new markets.
You can't blame the drugs company for trying to sell the products.
So what you're saying is that there is naturally in any capitalist society a motivation to make money if you're a company, and if you're a company who sells drugs, you're going to want to sell drugs.
And actually, that's what I'm saying. The economy in the country encourages companies to advertise for their products. And whether you're now a gun company, or whether you're a pharmaceutical company, or whether you're a car company, you want to sell your products. And you're actually forced to sell your product because of the shareholders, because they want to make a profit. People should be aware that advertised stuff is only used to sell the stuff. And it's not to provide an honest and open view on what the stuff is actually capable of doing.
Hey, I'm the director, Lucy King. This documentary was the result of a year-long investigation by myself and the video team here at Quartz. By becoming a member of Quartz, you will be supporting in-depth reporting like this. You'll also get access to exclusive coverage, analysis, and insider insight into the global economy. Click the link here to sign up for a free membership trial.